7:54 a.m. and welcome back to the Tobago Updates morning show, coming to you here live from the Port Mall in Scarborough. In this segment, we are chatting with Dr. Faith B. Israel, Secretary with responsibility for the Division of Health, Wellness and Social Protection. Morning. How are you doing this morning?
Good morning, Julian. I am great. Good morning, Tobago, Trinidad and Tobago, and everyone who's listening.
Well, I have to start this interview before I even get on topic by asking, how was your long weekend in Tobago?
Oh, it was one of the longest weekend on earth, and I enjoyed every second of it.
All right, excellent indeed. So this morning we're heading on into the conversations regarding an update on COVID-19 and also speaking to another reality that is before us in terms of the monkeypox. So let's start with COVID-19. Where are we at in Tobago? We've seen changes being made in terms of the reporting and so on. Right. We have seen persons now returning to being outside. The mask wearing mandates have been removed. How should we feel as the general public going forward?
So I think we should still be cautious. Let's not throw everything out the window. As you rightly said, we have changed our reporting mechanism. So now we're not doing the daily COVID reports anymore. You get weekly reports. So every Monday morning, you get a report that reflects the Sunday to the Saturday before. So the numbers that you're seeing, that is for the entire 7-day period. We do realize, though, that since we've started doing it, we're seeing a little bit of an uptick. We started with a 70-something 1 week, a 90-something 1 week. Now we're 100-something 1 week, so it's going up a little bit, but we expected that. We expected that given the new variants that we have of COVID. The variants that we have is the BA.5 and that one, Omicron BA.5, and that one, they say it's a little bit more infectious, meaning more people will get infected, but people are not getting very sick. So the uptick in the numbers is not surprising. That's what we expected given the variant that we have now. So we are also not seeing significant deaths or anything like that. So that I am happy about. We are still encouraging people to still use your mask. Even though we've lifted the mandate, if you think that you are sick in one instance, or if you think you're going into a space that you don't have proper airflow and that kind of thing, definitely still wear your mask. You be comfortable. You do what you need to do to be safe.
One of the pet peeves for me, Dr. Faith, how do we get business places and entities to recognize that with or without the regulations, maintaining that sink and soap and water on the outside is a plus for the entire society? How do we get that message out there?
Yes, that is one of the things I noticed. It is as if when we said no longer move your mask, it means no longer move the sink. So I am actually encouraging the business places to still maintain that sanitization. So the sink, the water, the soap, definitely. If you've decided to remove those, then please have hand sanitizers on entrance, so that at least when people enter your facility, they are able to sanitize their hands with alcohol-based sanitizer. So please, and if you are going around and you do not see the sink, you do not see the hand sanitizer, you still buy your own hand sanitizer, have it on your person, and use it as you go along, please. Definitely.
So you just mentioned in terms of the variant, this new variant that we're facing once again. Remind persons for me in terms of the protocols, get in contact, taking on that personal level of responsibility. Those were things that we once heard every hour, every 2 hours in the media space every day. So just remind persons again what's required under those circumstances.
Certainly. So if you feel that you have COVID, if you think that you are sick, you can call 800-HEAL or 211 and they can schedule a test, schedule you to go up to the Old Fort to be tested. You can't just go up there any day, all day to get tested. You have to be scheduled, and particularly since the numbers are lower, we are managing the resources, so we don't have people just sitting there if we don't have people scheduled to come in and get tested. Definitely, if you are sick, stay home, stay away from work. Don't go, because that is where you are able to interact with other people and therefore get other people infected. Keep washing your hands with soap and water. We said before, the soap is what actually kills the outer layer, that protein membrane of the virus. The soap kills that, or the soap breaks that off, and that is what in essence kills the virus. So keep washing your hands, keep sanitizing. Again, keep wearing the mask if you are going out and you need to be in, particularly in enclosed spaces, places that do not have natural airflow and so forth. Keep wearing the mask. There are businesses that will tell you you still have to use the mask to come into their businesses, and they have all the right to do it. The only place we still have a mask mandate are in the health health facilities. So the hospitals, the health centers, and so forth, once you are going into those facilities, you are still required to wear your mask in those health facilities for obvious reasons. So we're just encouraging people to still think about it, keep listening, keep following along. Don't panic. Don't get too wild. Don't think, well, oh Lord, everything done, let us now go back to normal, because we're not quite there yet. But this is something we're figuring out how to live with, and that's what we're encouraging people to do.
And it would be remiss of me if I didn't use an opportunity like this. We have been through 2+ years in terms of the pandemic and going, and we have a situation where critical at the essence of this are healthcare workers. What's your message for healthcare workers as they continue to remain dedicated to the cause?
These are the heroes. These are the heroes that I don't know that people recognize, that while the rest of us had the opportunity to stay at home and had the opportunity to relax and dress back and think. These are the individuals who've been working tirelessly for the last 2.5 years, and we need to seriously congratulate them, seriously thank them for their effort. And it was actually one of the reasons why, when we came in, one of the things we did was sign that 3-year contract with them, so that they know that because COVID is coming to an end, you've worked so hard, you've been on that month-to-month contract before. It doesn't mean that we're over with you and we're just going to kick you aside. No, we want to give you that kind of assurance that you'll keep having employment, and that we will keep doing our best to treat with your needs continually. So again, thank you to all of the healthcare workers who've been consistently working. And we are getting to the end of COVID, quote unquote, and this other thing is now jumping on board. And I am having the conversations with my health professionals again, and we're like, when is this going to come to an end? So we understand how tiring it is, but I continue to thank them for their dedication and their hard work. And
you've touched right on into the reality that we're required to face. We're now, we've been hearing in recent times far and wide. We're still thankful, and some would say not yet, in terms of monkeypox being, arriving here in Trinidad and Tobago. But tell us about our preparedness here in the Tobago space in particular. We heard some information being put forward by the Minister of Health with regards to Trinidad and Tobago in terms of being prepared for the challenge of the monkeypox. Tell us about our Tobago preparation.
Certainly. Well, we've been actually doing quite a bit in Tobago. We've ensured that our health professionals, are very aware of what to look for, because we've recognized that in the United States, by the way, United States has one of the highest rates of monkeypox right now. Imagine that. That is something we need to be very, very concerned about, because that's right there. All of it does go America and come back. So we have to be very, very concerned about that. But we have put in place a 3 I's mechanism that we are using internally and externally. The first I has to do with identify. So we've actually been going around. Dr. Nathaniel Duke, our infectious disease specialist, has actually been part of the team leading the charge of going around to the different health facilities, to the health centers, the hospitals, and so forth, and educating them about what monkeypox looks like, what to look for. So if somebody comes in with, they came in because they're coming into the STI clinic, or they're coming in and they have these lesions or they have these bumps, and this is what is happening to them, this is what to look for. So the first I is identify. Now that we've identified that you may be a monkeypox case, because we are not at the point where we are testing for the virus just yet, we then isolate you. Now, the good thing about coming out of COVID is that we are all now quite comfortable with quarantining and isolation. Maybe not comfortable, but we know what it means. So that is the second I, isolate. So once we've identified that you may be someone who has monkeypox because you have all these signs and symptoms and maybe a travel history and that kind of thing, we then isolate you. After you've been isolated, we then inform. What does that inform mean? We then inform the Office of the CMOH so that we can track the cases that we have. We then inform the Office of the CMOH, then informs your contacts, so people who you may be in contact with, to see, well, okay, you've been in close contact with this person, you may then need to be quarantined and that kind of thing. So it's identify, isolate, and inform. Those are the 3 I's that we've been working with. And I think we are prepared. We are at a point where, you know, the first time it happens, there'll certainly be hiccups. There'll certainly be things that we did not anticipate. But we have been learning the lessons from COVID. And now that we've figured out what worked and didn't quite work for COVID, we are translating many of those lessons to monkeypox if and when it comes to Tobago.
All right, I like how you say if and when. Some say when it is, you know, in truth, looking towards the fact that it might be a reality that we're going to potentially have to face. I want you, for the purpose of our viewers and listeners out there, you know, in terms of describing, from your understanding, what are some of the, you know, potential indications or symptoms associated with monkeypox?
Certainly. So monkeypox it's one of those things that we hear the monkeypox and we think about the lesions, the pox that is on your skin. That is usually the last part of it. So by the time you get to the pox, it's probably because you've had a severe fever sometime before. It's probably because you've had really bad headaches or you've had muscle pains before. All of that sound like a cold, right? All of that sound like a normal cold. I know. So that's why we have to be very, very careful with those things. And after you get those, then you start getting the lesions, what looks like bumps. It may start off looking like pimples, and then it becomes a lesion that actually has a scab that peels off after a while. Now, the thing that's important to know with monkeypox is that the liquid that is oozing out of those scabs, that is oozing out of the pox, that is actually what is most infectious. So it is when you come into very close contact with somebody who has those lesions, that is when you are more likely to get in contact, to get infected. And that is why the cases we've been seeing thus far, most of the cases that we've been seeing thus far in the United States and all over the world, have really been cases that have been transmitted via sex, because, you know, you're having very close contact with somebody while having sex. It is not a sexually transmitted disease or infection, but simply because you are having such close contact, that is when you have the opportunity for the lesion to then rub on somebody else's skin. So particularly if you know somebody who you're having close contact with, sexual contact is one instance. If there are people, for example, there have been cases of a few children who've gotten monkeypox in the United States, and they're indicating that those individuals may have actually been, you know, hugged up or cuddled and kissed, you know, that kind of thing, with somebody who had monkeypox, and that is how they were able to get it. So it's that close contact, which is very different to COVID, because with COVID you did not need the close contact. You just had to be in a close enough space with the person. So even though this is the WHO has indicated that this is a disease of global, you know, public health concern in essence, it is not quite a pandemic yet, because we are not at the point where we have cases in every single country and every single region. We are not there yet. Hopefully we don't get there, but it really is something that we need to be concerned on because of the sheer numbers that we are seeing thus far, and particularly the sheer numbers that we are seeing outside of the areas where we normally see monkeypox.
As you mentioned, that some would have raised concerns in terms of with the operationalizing of the New Roxborough Hospital, continued operations of the hospital up at Signal Hill. We had the activation of the old hospital, what we'd call up at the old fort, Fort King George, that some are concerned in terms of the continued offerings of services at the health centers in the various communities. Is it that has been reduced, or we continue to see those health centers fully operational in terms of meeting that need, starting from right within your very own community before you even have to get to the major hospitals?
Certainly. So what we've been doing during the COVID period, we've had to pull back on what we call regular routine services. So we are at the point where we have returned to routine regular services at the health centers and at the hospital. So you go into your regular clinics, you're having your elective surgeries are happening now. We have actually not deactivated up at the fort because we still have a few patients with COVID who still need to be hospitalized, and they are still up at Old Fort. We also have the ICU that we are readying for use. Hopefully we never use it, but we are readying for use. It was just handed over a couple of weeks ago, and we actually have other spaces where we can can have people who need to be isolated even if they are well. So you should be able to get your regular service at your health center, at the hospital, and at Roxborough as we expand the offerings that are happening at Roxborough.
Tell us as well about, as we look to wrap this morning's interview, contact and follow-up for those persons that continue to have that need, those persons who have been grossly affected, going through this pandemic, and families that are still in very much of a challenged position. The response and support in terms of social services, for which a great part of the responsibility falls within your division.
Right, so let me pull up the number. So if you need to be tested and so forth, the same numbers that we were using before, 800 HEAL and 211 are the numbers you can call. Right. If you need help with getting social support, you can call or WhatsApp 683-8347. That's 683-8347. That's if you need getting, social support, getting a food card, getting that kind of thing. Or if you need counseling specifically, we also have a counseling hotline where we have our therapeutic counselors sitting there waiting. 683-8341. That's for the counseling hotline, 683-8341. So you can call any of those numbers, WhatsApp those numbers, and you'll get help.
And in the mix in all of this, you all apparently still find ways in the division to keep staff going. Give us a little insight into your Emancipation Drive that we saw via social media.
The Emancipation Drive, and unfortunately I had to treat it an emergency, so I was not able to actually attend. But that was a really, really nice initiative where we had a lot of our staff members coming and showing off their clothing and that kind of stuff. If you look throughout the THA, there was several activities like that throughout. And that is what we have to figure out, what is the mix, what is the balance to ensure that everything works. Well, I want to congratulate my communications department, because they are the ones who pulled that together and nice. Managed that even in my absence. They did a really good job at that. So yeah, so we still have to figure out how we're doing all of that and still splicing, having fun, still splicing spice in the middle of all of it.
After a weekend like this, spice indeed. All right, so Dr. Faith, just a reminder to the Tobago public in terms of being able, while we outside now, still being able to ensure that we are as responsible as we can be under the circumstances, to really hope and pray that we get past without getting the full brunt of what's out there.
Certainly. So definitely pay attention to your surroundings, pay attention to the people around you, particularly if you're coming into contact with somebody who has traveled outside of Trinidad and Tobago and they have a fever, they have a flu, they have fever, headache, muscle pains, and they have lesions on their hands or in their mouths or at the butt, in the palms of their hands and so forth. Pay attention to that. If that is you, call 211 or 800 HEAL, and we'll come and deal with you. We'll come and treat with you. But if you are unsure, call 211. If you are unsure, call 211.
To be able to call for direction. So
yeah.
Folks, you have it there, information to continue to guide us even in these times, so that there shouldn't be any fear even heading into the great race, upcoming activities and others in the season. And particularly, before we wrap this morning, vaccination responsibilities for parents and so on, with children are preparing to return to school. I missed that question there.
Yes.
Preparing to return to school. Any quick information to guide our parents with what's required? Certainly.
So we still have vaccines for children, so you can go to Scarborough, Canaan, Roxborough health centers, and you'll get the vaccines for children who may be going back to school in September. So definitely keep doing it, keep getting them, and we just have to keep rolling with the punches. We just have to keep being responsible.
Right, excellent. Thank you very much there again, Dr. Faith B. Israel, Secretary with Responsibility for Health, the Tobago House of Assembly, joining us on set here this morning. Viewers, at this point, we're heading on out of the Tobago Updates morning show. We want to thank you so much for your continued love and support. In the mix here, I particularly want to highlight, I see Russell Morrison saying, I'm home in sweet Tobago. And that's the kind of joy when you view the Tobago Updates morning show from far and wide, and you're happy to be home here. Coming in the mix, I see Carissa O'Connor as well, Jeanette Roberts. Thank you so much to each and every one of you for the continued love and support. Those of you joining us via TV, those listening to us on radio, and those of you continuing to connect with us online. At this point, we prepare to wrap the Tobago Updates morning show, and we head on over to GMT. Good morning, Tobago, with Candice. So bye for now, folks. Have a great day. All right, and remember to stay tuned as we head on over to GMT with Candice.